sir. I am Noreen Asuncion, Level 3 Nursing Student of President Ramon Magsaysay State University. So for this video, I will be performing a return demonstration of inserting a nasogastric tube. So I would like to say that some of the equipments that I will be using for this video are improvised. So to start, we need to verify first the doctor's order for the insertion of nasogastric tube. And then after that, we need to perform hand hygiene for infection prevention and put on personal protective equipments if indicated. And then after that, we need to introduce ourselves to the patient and verify the patient's identity using the two identifiers, which is the name and the date of birth. So, good morning, ma'am. I am Noreen Asuncion, your nurse for today. May I know your name and your date of birth, ma'am?
My name is Francis K.A. Patrick, and my birthday is February 13th and 2012.
Okay, so thank you, ma'am. After that, we need to explain the procedure that we are going to do, why is it necessary, and how the patient can cooperate. Now, after explaining the procedure to the client, we need to gather all the equipments necessary for the procedure. Then, after that, we should close the patient's bedside curtain and assist the patient in a high folders position, or just elevate the head of the bed 45 degrees if the patient is unable to maintain upright position. Okay. After positioning the client in a high folders position, what we need to do next is to drape chest with bath towel or disposable pad and have emesis basin and tissues handy. And then after that, we should measure the distance to insert the nasogastric tube by putting the tube at the patient's nostril. So just assume that this is a nasogastric tube. So to measure, we will start from the nostrils to the tip of the earlobe, and from the tip of the earlobe to the xiphoid process. Okay, so after measuring it, we should put on gloves and lubricate the tip of the tube with water-soluble lubricant and apply topical anesthetic to nostril and oropharynx as appropriate. So just assume that I have already put on my gloves. Now we will going to lubricate the tip of the tube. And then after lubricating it, and after selecting the appropriate nostril, ask patient to slightly flex head back against the pillow and gently insert the tube into the nostril while directing the tube upward and backward along the floor of the nose. And we should also provide tissues for tearing or watering of eyes and offer comfort and reassurance to the patient. And when pharynx is reached, instruct patients to touch chin to chest and encourage patients to sip water through a straw or swallow even if no fluids are permitted. We just assume that I have already inserted the nasogastric tube. So, if gagging and coughing persist, stop advancing the tube and check placement of tube with tongue blade or flashlight. So just assume again that I already have inserted the nasogastric tube. Now, we need to secure the tube loosely to the nose or cheek until it is determined that the tube is in the patient's stomach. So, to check, we need to attach syringe to end of the tube here and aspirate a small amount of stomach contents. And then after that, we should apply skin barrier to tip and end of the nose and allow to dry. And then after that, we should measure the length of exposed tube, reinforce marking on tube at nostril with indelible ink. And then we should secure tube to patient's gown by using rubber band or tape and safety pin. And then after that, we should assist with or provide oral hygiene at 2 to 4 hour intervals and lubricate the lips generously and clean the nares and lubricate as needed. And then remove equipment that should be removed and return patient to a position of comfort. And then remove gloves, raise side rail and lower the bed, and then remove additional personal protective equipments if used, and then perform hand hygiene. So that is all for this return demonstration video. Thank you.